So the aim of the upcoming partnership is promoting and maintaining brain health. And that means introducing the concept of brain health, both dimensions being the neurological as well as the mental health dimension. And if we look at the issue of brain health in societies, we can see that it's burning. We can see that in Europe and worldwide, that in the light of the multiple crises we are facing, be it climate change, be it war, conflicts, and demographic change, there is an increasing rate of brain disorders, and the most vulnerable especially affected. So it's already very clear that no single country can tackle these challenges on its own, that we need to come together and have a common basis and to create a critical mass there. So what we're doing here is to build on 2 decades of funding, be it by the Commission and the member states. And what we would like to do there is now to design a common umbrella for the future European Partnership for Brain Health. And there will be more than joining these networks which are already existing. There will be a widening of the scope, be it by geography. That means integrating more countries and funding agencies, be it by research topics we are addressing, but also by the way we are engaging with stakeholders. The overall aim of the coordination and support action will be to create the ground and prepare the ground for the future European Partnership for Brain Health. That will be starting in 2026. And that is a unique opportunity here to create an ecosystem fit for purpose. And that means basically here to overcome artificial boundaries and to create solutions which are accessible and affordable and tailored to the needs of the people affected by brain disorders as well as society as a whole. And that one resulting in a translation of research into new solutions on the 4 dimensions we're having here. That means prevention, diagnosis, treatment, and care. The CSA is characterized by its transnational character. So there are 21 partners from 11 countries, and that already tells you that this is really transnational in its essence. No? It is organized in 6 work packages, and there are, as I said before, the overall aim is the preparation of the future European Partnership for Brain Health. And that means that we have 3 overall objectives. And one of them is the structure and the governance of the future partnership. But we need to also, for the future work, we need to generate a research and innovation agenda. And the other part is there to establish an intensive dialogue with all the stakeholders. The key point of all these activities is to achieve high financial commitments from as many countries, ministries, and agencies as possible for the futureship, because that's what we are running with the commitments we are receiving there. The way we structured it to give them a good landing page there is that we implemented a funders forum. And there we have now already over 50 representatives of national ministries and funding agencies, and they are from more than 30 countries. So this is one way of structuring the commitments we need to implement our objectives here. The other way is in the structure to ensure that it's really fit for purpose is to engage with stakeholders. And that means we engage with patient organizations, but also with healthcare providers, with private sector. And we reach out for global organizations and other health relevant partnerships and initiatives. And one way we are doing that in this year will be around an open consultation process for the research and innovation agenda I mentioned earlier. So please join us in this consultation and contribute your topics and views. We are looking forward to your feedback.